I'm a nurse practitioner in a family practice setting. It's a primary care, and it is a private practice, and we see patients from 5 years old up to the end of life. I do women's health also. However, I do not deliver babies. Nurse practicing in primary care, I think, is a little bit different than some of the specialty practices in that we do have a lot of autonomy. I see my patients, I diagnose, treat, and take care of them with very little input from the doctor. They're my primary responsibility. And that does happen with nurse practitioners in other avenues, but I think it's seen most particularly in the primary care arena. Nurse practitioners can function very independently and autonomously, and that's what I do. I spent 16 years as a critical care nurse. I did everything from emergency room to intensive care unit to electrophysiology to stem cell transplants to clinical research trials. I was all about acute care for 16 years, and then I started working part-time with a primary care doc, and he was like, "Oh my God, you belong here." And I'm like, I really just wanted to, I was so into the adrenaline rush of the hospital that I never thought that I would really appreciate this. However, it didn't take me that long to fall in love with it. The nurse practitioner programs are a master's level program. There are several specialties in the nurse practitioner program. There's adult and there's women's health, and the family practice is a little bit more advanced in terms of how much clinical time you need. So it's usually 2 or 3 years as a master's level program. However, that is going to be changing. By 2015, they are really going to try to incorporate the concept of the doctor of nursing practice as an entry-level position. There are plenty of doctors of nurse practitioning. There's plenty of doctorate programs for nurses in a variety of different areas in education and administration and so on and so forth. But the doctor of nursing practice is being worked on as the entry-level position in the future. Most of the time, we start our mornings off with our physical exams, routine physicals. People come in for their wellness check, and we go over all their screenings and make sure that everything is up to date. And they do a full physical exam and talk to them about issues that they might be encountering. So those are all kind of routine things. And then people come in for their acute issues. And this is a very, very important part of primary care because early access to acute care issues can save gazillions in healthcare dollars. If someone comes to me with a non-cardiac chest pain, obviously if they're cardiac chest pain, they need to be in the hospital. But if they're non-cardiac chest pain, I can evaluate, treat them, take care of them for a very nominal fee, as opposed to if they went to the emergency room, it would be a fortune. So I like my patients to know that they can get to me quickly if they're sick. Okay, and just to remind the audience that nurse practitioners maintain their RN license throughout their career. We're still RNs. And in RN, they're not allowed to prescribe medication. They're not allowed to prescribe diagnostic measures. They're much more limited in their scope. So although it's extraordinarily important being a nurse, this takes the nursing role and just advances it into an arena where you have more autonomy. Excellent communication skills, absolutely positively important, because that's a huge issue in medicine, that people don't feel like they're being understood or listened to or cared about. So that's very, very important that they have somebody. Empathy, of course. You have to love people. You have to love medicine. You have to love the concept of keeping people well. So that's it's an absolute passion for me, and I can't imagine doing family medicine without that passion. And flexibility. When you're in family medicine, it's different than a specialty because you really do cover all the systems. And you cannot be expert in every single system. You have to know when to collaborate with specialists. You have to know when to be resourceful yourself. You have to know when it's time to do your research and know your limitations. And you have to be able to be fluid with all the different needs. Well, there's tremendous challenges in terms of public relations. First of all, not everyone knows who we are. We've sort of been buried. We haven't been able to, well, we're doing that now, but a lot of people really, truly don't understand who we are and what we are capable of doing. So the general public needs to know a little bit more about us. And then there's also the legislative issues. Every state has different legislative issues that they have to deal with. We work very, very aggressively with our legislators in terms of eliminating this mandatory collaboration that we have, because it is a barrier to care. It's a barrier to the access of people's care. And it also impacts upon our reimbursement from insurance companies. So that's a mountain we're getting over. I'm in the South Shore of Long Island, which is a very middle-class area where there's lots of doctors around, and they choose to see a nurse practitioner. I have plenty of patients, and the word of mouth and everything. So I see that as a huge change. When I first started, I used to have to do this whole song and dance of who I was and what I was and where's the doctor, and you know, it's like this whole thing. And now it's like, oh yeah, go to my nurse, you know. And it's really a kitchen table conversation, you know. It just become like normal part of our community. I think it's going to blossom tremendously. Only 2% of medical school graduates go into primary care now. And yeah, so that's huge. So there's going to be, especially when the Affordable Care Act comes to fruition, and all these people are going to start having insurances, they're going to be all looking for a primary care provider, and there's just not going to be enough out there. So I think that this is going to be, it's a role that's going to just explode. I really do. Michelle Obama just did a teleconference with RNs. It was all over the country, and they discussed all the future and how the Affordable Care Act is going to positively impact the future of nursing. And for instance, there's $31 million now that's going to be expanding NP and midwife education. There's going to be more nurse-managed clinics. One of the big issues within the Affordable Care Act is to provide that early access to care that I was talking about, but to expand that into even underserved areas. There are certain things that doctors had access to that now nurses will have access to. So I do see a lot of progress being made, and there's a lot more understanding going on out there. The Nurse Practitioner Association of New York State, I think it started in 1980, and it's, you know, it's an advocacy group. We focus on doing everything possible to help the nurse practitioner along in their practice. We are involved with legislative issues, we're involved with preceptor issues, we're involved with job postings, we're involved with educational seminars. We have student dinners, we reach out and those, so not only do you get the educational piece, but you also get the networking piece. And we do offer scholarships. And we also work with people on research grants. So there's really, I think we cover the gamut of anything that a student would want from us. We're here for you. Love to have you. As the healthcare reform is unfolding, we need to position ourselves and make the public and legislators aware of who we are and what we are, so that we will be placed in those kind of roles. And nurses in general have to be proactive with themselves. You know, we need to be in a position where we can sort of say, you know what, I think you need a nurse on the board.